Let us try and understand plasma protein albumin. Now, what are plasma proteins? The plasma proteins basically include proteins which are present in the plasma. So they include three proteins which are albumin, globulin, and fibrinogen. So the normal range for albumin is 3.5 to 5 grams per deciliter. Globulin is 2.5 to 3.5 grams per deciliter, whereas fibrinogen is roughly 200 to 400 milligrams per deciliter. So albumin and globulins are present in grams, whereas fibrinogen is present in milligrams. The next term is serum proteins. So what are serum proteins? So serum proteins are proteins which are present in the serum. Okay, so what is the difference between serum proteins and plasma proteins? Okay. So if you see over here, serum basically is plasma minus fibrinogen. So from this plasma protein, if you remove fibrinogen, what you get is serum proteins. Okay. Why fibrinogen is getting removed? Because fibrinogen goes into clot formation. Okay, and serum we get after formation of clot, after retraction of clot. So when serum is formed, fibrinogen is consumed. So what is remaining is albumin and globulin. So normally we test for proteins in serum. So serum proteins include albumin and globulin, and total proteins are albumin and globulin. Let us now look at albumin. Now albumin is the major plasma protein. It is a complete protein. That means it contains all the essential amino acids. It is a single polypeptide of molecular weight 69,000 daltons. It is synthesized exclusively by the liver, and it is an important synthetic function of the liver. So by testing albumin, we also come to know the synthetic function of the liver. And if the albumin levels are low, it is below normal. So one of the cause can be that the liver is not synthesizing enough albumins. Okay. And low albumin concentration is clinically manifested as edema, okay, which is visibly seen. So this is edema. If you look at compare the foot of these two pictures, on the right side this is the normal foot, whereas the left side this foot is swollen. So this foot is swollen because of accumulation of fluid in the interstitial space, which is called edema. And edema can be tested by applying pressure over a bony prominence, and when the pressure is relieved, you get a pit over here like this. So this is an example of pitting edema, okay, which is nothing else but accumulation of fluid in the interstitial space. Okay, so what basically is edema? Let us see. Now the body content, water content is roughly around 60 to 70%. Now how is this water content divided in our body? Okay, so basically we have two compartments. One is intracellular and the other is extracellular. So the major portion is by the intracellular compartment. So the major water is located inside the cell, which is intracellular. Okay. The rest is located outside the cell, which is extracellular. Now this outside the cell again is further divided into intravascular and extravascular. Okay, so the water which is located outside the cell can either be present inside the blood vessel, then it becomes intravascular, which is roughly around 5%, and the rest 15% is in the interstitial fluid or extravascular compartment. It is here when the fluid starts accumulating, it results in edema. Okay, so basically the fluid which is present in the intravascular compartment goes into the extravascular compartment, which is called edema or swelling. Let us now look at functions of albumin. The most important function of albumin is colloidal osmotic pressure. It maintains the colloidal osmotic pressure. Now it is the pressure which is exerted from extravascular compartment to intravascular compartment, and it is exerted by plasma proteins. Okay, so let us look at the capillary end. Okay, so to understand this, so we have basically two systems to blood vessel system. One is the arterial system and the other is venous system. Okay, so the arterial system comes from the heart, goes to the tissue, and at the tissue end you have capillary formation, and then from there the venules they form and you form the vein which goes back to the heart. So this is how the blood circulation goes around. So at the end of the capillaries, you have an arterial end and a venous end. Okay, and this same thing is magnified over here. So at this arterial end, okay, so this is the arterial end and this is the venous end. So at the arterial end, we have basically at the capillaries, we have two pressures which are acting. One is the outward pressure, okay, which is pushing the fluid from intravascular to extravascular. So which is this pressure? This pressure is the blood pressure, okay, which we commonly measure. So it's an outward pressure which is exerted on the walls of the arteries. Okay. Similarly, we have colloidal osmotic pressure, which is an inward pressure, which is exerted from extravascular compartment to the intravascular compartment. And this colloidal osmotic pressure is exerted by albumin or plasma proteins. So at the arterial end, if you see, we have the external pressure, blood pressure, okay, which is forcing the fluid outside, which is roughly around 35 mm of Hg. Okay, whereas the colloidal osmotic pressure is roughly around 25 mm of Hg. So which pressure is more? The blood pressure is more. So as a result, fluid goes into the interstitial space. Okay, so we have a difference of 10 mm of Hg. So this 10 mm of Hg excess of pressure drives the fluid outside from the intravascular to the extravascular compartment. Okay. Now at the venous end of the capillary, okay, this is the venous end of the capillary, you see here the blood pressure decreases. It becomes 15 mm of Hg, whereas the colloidal osmotic pressure increases. It is 25 mm of Hg. So difference is again 10. Okay, so this 10 mm of Hg pressure, which is excess pressure, which is from extravascular to intravascular. So this drives in the fluid which has come out, and this goes back in. So this movement of fluid from intravascular to extravascular compartment, again from extravascular compartment to intravascular compartment at the capillary level is by Starling's law. So this law is called Starling's law. Okay. Now let us assume that the patient's albumin levels are low. Okay. So if a patient has low albumin levels, see the colloidal osmotic pressure also will become low. Okay, so let us assume the colloidal osmotic pressure over here becomes 15. Okay, 1,5. Why? Because the patient's albumin levels are low. So as a result, the fluid which is coming out over here will be more. So the excess pressure over here will be 20. Okay, so the excess of fluid which has come out more than as compared to normal. Now at the venous end, again the blood pressure is 15. Now the osmotic pressure here again is 15. Okay, because we have is low albumin levels. So the colloidal osmotic pressure also is low. So as a result, the blood pressure and the colloidal osmotic pressure becomes same. So the fluid which had come out from the intravascular space does not get back in. It does not go back in. So as a result, the fluid starts accumulating in the extravascular space or interstitial space, resulting in edema. Okay. So this was about colloidal osmotic pressure. Next important function of albumin is transport. Okay, transport a lot of things. Most commonly bilirubin, fatty acids, calcium, hormones, and drugs. Okay. So when for example, let's say calcium, hormones, and drugs, so when they are binding with albumin, so they become non-functional. Okay, for example, calcium, when it is binding with albumin, it is transported in the form of binding with albumin. So the calcium which is bound to albumin is non-functional. It is not available for action. It is only the free calcium which is not binding with albumin which is functional. Similarly, hormones. Okay, hormones like steroid hormones, thyroid hormones, which bind with a percentage binds with albumin. So as long as the hormone is binding with albumin, it is not functional. It's only when the hormone is displaced, when it is free, then that hormone becomes functional. Similarly with the drugs. Okay, we have drugs which are binding with albumin, it is not functional. When the drugs are displaced by the albumin from the albumin or is removed from the albumin, then it becomes functional. So albumin, that is why albumin helps in transport of all these important constituents. Next important function of albumin is buffer. So we have studied in the previous lecture that proteins, they have ionizable groups. Okay, so because of this ionizable groups which they have, which is carboxyl group and the amino group, okay, they can act as a buffer. Okay, so buffer is nothing else but anything which resists a change in the pH. So why does proteins act as buffer? Because proteins consist lot of histidine groups, specifically albumin. Albumin consists lot of histidine amino acids. Now histidine amino acids have, they can act as buffers. Okay, their pK value is closer to the pH value of our blood, and that is the reason why they can act as buffers. Okay, so how proteins act as buffer, I will take a detailed lecture later on. Okay, for now, just remember, proteins, one of the functions of albumin is they act as buffer. And why do they act as buffer? Because they have a lot of histidine amino acids. Next important function is albumin also is a source of nutrition for all the other cells, because albumin is a complete protein. It contains all the essential amino acids. So other cells take up albumin, break it down into individual amino acids and use it for their purpose. Okay. Now coming to clinical significance of albumin. The first one is albumin, when complex with free fatty acids or unconjugated bilirubin, it does not cross the blood-brain barrier. Okay, so free fatty acids are not available to the brain for utilization. Okay, and the other important point is unconjugated bilirubin does not cross the blood-brain barrier. Okay, because unconjugated bilirubin, if it crosses the blood-brain barrier, it can get deposited in parts of the brain like basal ganglia and can lead to disorders like kernicterus in newborns. Okay, so this is a good thing that albumin complexed with unconjugated bilirubin does not allow it to cross the blood-brain barrier. It only transports the bilirubin. Next, drug interactions. Now this again is very, very important. Okay, for example, let us say albumin is combining with drug A. So as long as albumin combines with drug A does not function. Now when a patient takes in drug B and drug B preferentially binds with albumin more as compared to drug A, so drug B will displace the drug A from albumin. As a result, drug A will start acting. Okay, so when we are giving combination of drugs, we should know which drug is more binding with albumin. Or in other words, what are the drug interactions that will take place. Okay. Next, total calcium levels. Okay, total calcium levels are affected by albumin concentration. Why? Because albumin binds with calcium. Okay, so if albumin levels are low, calcium levels automatically will become low, total calcium levels. Okay, and similarly, if the albumin levels are high, total calcium levels also will be high. Negative acute phase reactant. Albumin also is a negative acute phase reactant. That means acute phase reactant. Okay, so the term acute phase reactant means it's a reaction by the body which occurs in acute setting. For example, inflammation, acute fever. Okay, so whenever acute inflammation takes place, the body reacts with certain parameters which are produced. For example, C-reactive protein. Now, C-reactive protein is a positive acute phase reactant. So, if a person is having inflammation, C-reactive protein is increased as a response to it. Okay. Now, albumin is a negative acute phase reactant. So, whenever there is an acute inflammation, okay, for example, fever, the albumin levels they decrease. Albumin concentration goes down. So, it's also a negative acute phase reactant. Okay, so we should keep this in mind because under acute conditions, acute inflammatory conditions, the albumin levels are going to be little low. Now let us look at causes of hypoalbuminemia. So first is malnutrition. Okay, so because albumin is a complete protein, it requires all the essential amino acids. So essential amino acids, it is called essential amino acid because we require them in the diet. It is not produced in the body. So in the diet, if you're not taking in essential amino acids, so the albumin is not going to get formed from the liver. So as a result, you'll have hypoalbuminemia. So malnutrition, when the patient is not taking in essential amino acids, so will result in low albumin levels. And liver disease, because we know that liver synthesizes albumin. So albumin is one of the synthetic functions of the liver. So if a patient is having liver disease, a chronic liver disease, so the liver's ability to synthesize albumin will decrease. So as a result, albumin levels will be low. Renal loss. Now the albumin is getting formed normally, but it is getting lost from the kidneys. Okay, for example, in conditions like nephrotic syndrome. Okay, so where or glomerulonephritis, where the albumin is getting lost in the urine. So as a result, the albumin levels become low. Or albumin can be lost from a non-renal cause, not from kidneys. It is getting lost from someplace else. For example, skin. When there is burns, excessive burns, so the albumin is getting lost from the skin. Or in case of hemorrhage, or in case of protein losing enteropathy or loss from diarrhea. So these are causes in which proteins are getting lost from the body, but it is not from the kidneys, some other organs like GI tract or skin. Or conditions of volume overload. So the albumin is synthesized normally, but there is excess of volume overload, excess of plasma which is present. For example, in case of congestive heart failure. Okay, so the plasma concentration, the water concentration, that increases more as compared to the albumin. So similarly, in case of pregnancy, again we have a volume overload. So in these cases, uh, the albumin levels are decreased, but it is a relative decrease. It is not an actual decrease. Okay, because the albumin synthesis is normal. Okay, it is only just the water content is increased. So it is a relative decrease of albumin. Okay, so hope you have understood what is albumin. Please like, subscribe, and share. Thank you.